Hello, this is my patient treatment video for clinical medicine. This is Colleen Alani. I have a 64-year-old patient with a history of smoking, and she has COPD. So I'm going to teach her how to use the bronchodilator and about her condition. Okay, so COPD is a disease state characterized by airflow caused by emphysema or chronic bronchitis. So what that means, it's a progressive airflow limitation that occurs through the inflammatory process of the lungs. So some of those symptoms that my patient can be experiencing are progressive difficulty breathing, shortness of breath, sudden weight loss, barrel chest, so that means kind of a pushed out chest from difficulty breathing, using her shoulder or accessory neck muscles for breathing as well, leaning forward to breathe, pursed lips, a pink appearance of the skin, and lastly, the patient with COPD will also have, they'll have a minimal or absent cough that's present. Okay, and some treatment options for patients with COPD are different things. So we could start with oxygen therapy, such as we could use medications, bronchodilators, smoking cessation, and that's all of that. But today we're going to talk about bronchodilators for my patient. So the purpose of bronchodilators is to decrease the resistance of airflow in the airways, and it allows more air to flow throughout the lungs. So therefore it makes breathing easier for patients by relaxing the muscles in the lungs and widening the airwaves, or the bronchi, which is the airway. So we know that bronchodilators are used for chronic obstructive pulmonary disease, which my patient has, as well as asthma patients when they have difficulty breathing. So treatment, actually, I have asthma, so I'm going to show with my Pro Air inhaler how to properly use a bronchodilator. So we can use either short or long-term acting bronchodilators with corticosteroids for worse conditions. In her situation, since she's 64 and she's had a history of smoking, her situation would use that as well. Okay, so we know that bronchodilators, we could say the inhalers, prevent COPD from flaring up from the condition randomly occurring, reduces shortness of breath, and controls coughing and wheezing in patients while breathing. Okay, so I'm going to go through the steps of how to use a bronchodilator for this patient, and I will also, after the steps, actually show it on my inhaler. Okay, so the first step is to shake the inhaler thoroughly before you use it. Remove the cap from the inhaler's mouthpiece. Take in a breath and exhale completely. Make sure you're exhaling completely to get all that air out into the lungs, into your bronchodilator. With the canister up and mouthpiece down, put the mouthpiece into your mouth and close your lips around it. So that's pretty obvious. The fifth step is take a fast, deep breath through your mouth while pressing firmly on the bottom of the canister, so the little button on the bottom. The next step is you have to actually hold your breath for 5 to 10 seconds to allow the medication to go fully into your lungs, so to make sure you have enough time. And if your doctor prescribes a second dose to this medication, wait 1 to 2 minutes, shake the inhaler, and repeat steps 3 through 6. Finally, replace the mouthpiece after each use, and make sure you rinse your mouth with water after using the inhaler. So I have a Pro Air inhaler for occasional asthma, and I'm going to show real quick how to use this for the 60-year-old patient. Okay, so we went through the steps. Make sure you shake it. I just removed the cap right here, and I'm going to take a fast, deep breath, and then I'm going to inhale the inhaler and hold my breath for 5 to 10 seconds so it can go fully in. and then I clean it after, and that's everything. Thank you for watching.